The first of our key exercises is the calves. And to do this, we're going to set the foam roller down, place the upper portion of the lower leg in the center of the foam roller. Now initially, you can start off with just the one leg on top, but you may find that you want the additional pressure that you can create by putting the other leg on top of that. From here, lift up the hips, roll slowly from the bottom of the calf to the top and back down again. I'd suggest doing one pass along the center of the muscle before turning the foot in slightly, performing one pass along the inside aspect of the muscle, turn the foot out slightly, one pass down the outside. Once you've done that, evaluate which of them feels more uncomfortable, and then focus your efforts on that area in particular. So using each of the 4 techniques, we perform our rolls first. Normally 4 to 6 of these is fine. You can then focus on adding some spans, rolling horizontally across the surface of the muscle, cross frictions, and mobilizations in the case of the calf, typically best achieved with the additional pressure of the other leg on top, circular movements in either direction at the ankle, or a simple flex and extend of the ankle as well. The second of our key exercise areas is the quad. To roll this area, start with the roller just above the knee at the base of the thigh. First option is to roll all the way up and all the way down. Bear in mind this requires a much greater level of anterior core strength to prevent the lower back from arching. Second option, come 1/3 of the way up the thigh and back down. Perform 4 to 6 rolls on this area before moving into the middle of the thigh, rolling that third, and then again to the top of the thigh and rolling that third. From here, we could then add the spans, 4 to 6 repetitions being most suitable. From here, we could add the cross frictions, that scrubbing-like motion across the muscle. And from here, we can add knee bends, which are our mobilizations. There's also the option to combine the two in this area, and we span at the same time as mobilizing the knee. The quads for most people are a particularly tender area, and initially we always want to make sure that we focus on technique rather than the overall pressure. So approach this area with caution, and gradually, as the tissue gets a greater level of movement and blood flow, start to progress the pressure then. The third of our key exercise areas is the glute. To roll this area, we're going to place the central portion of the buttock or glute on the center of the roller. And this is roughly where the pocket would be on a pair of jeans. The other hand is on the floor with the shoulder back and down, making sure that our shoulder joint is nice and stable. From here, we have a small rolling motion down and up the glute. 4 to 6 passes is normally fine. We can then add spans, which involves a small rotation of the hips horizontally across the surface of the roller. 4 cross frictions, which is where the same tissue is in contact with the roller and the pressure is constant as we move side to side. And then lastly, our mobilizations. We have 2 options. The first is a knee pull towards the body, making sure that we relax between each repetition. Or alternatively, we can come into a hip flex position, let the knee or thigh come out to the side before we pull it in. The particular focus here is on the inward movement, as that allows us to create movement along the line of fiber of the glutes specifically. The fourth of our key exercise areas is the thoracic spine, or the T-spine, as it's sometimes known. To roll this area, we're going to come down so that the roller is just at the base of the shoulder blades. Hand position, we can either go for the hands behind the head with the elbows relaxed out to the side, hands on top of the head with the elbows pulled in, or with the arms crossed over the body. From here, we'll lift the hips slightly, slowly roll up the shoulder blades until we get to the top of the shoulder blades before we reverse direction and head back down towards the bottom. Perform 4 to 6 rolls. Spans are only really suitable for the T-spine on the Grid 2.0 because of the width. The slightly reduced width of the original grid means that if you went too far, you're most likely to fall off in one side or the other. However, we can perform our cross frictions, which for the T-spine are performed by executing a side bend in alternating directions. And then our mobilizations, we'd start with the hands on the thighs, reaching up overhead, trying to keep the ribs down as we do so, and then bringing the hands back to the legs. All the time making sure that we don't lose that connection between the rib cage and the hips, and we keep a nice flat back. One thing that it's particularly important to be aware of is that we never really want to roll the lower back directly. So in performing this exercise, make sure that you only go down as far as the base of the shoulder blades and no further. Our fifth key exercise area is the lats, which are the most lateral of the upper back muscles. This is also one of the two main muscles that tend to tighten and shorten as a result of spending a lot of time sat down in what we call a protracted shoulder position. To perform this exercise, we're going to lie down on our side with the apex of the armpit, that triangular shaped portion of the armpit, directly on the center of the roller. Our bottom leg is out straight with our top leg just back slightly and the foot directly behind the knee. From here, we lift up with the hip using the other hand to offset the pressure on the roller, and we lift the arm slightly as we perform our rolls. This is not a big area to roll, so it doesn't require a huge amount of movement, but because of the fact that it can be uncomfortable, this is one time where it's particularly advantageous to divide the movement into sections in terms of the area that your muscle that you're working on. From here, we can add our spans by tipping the body forwards or leaning the body slightly back. Cross frictions by moving the rib cage forwards and back. Mobilizations for the lats are performed by bringing the hand towards the opposite shoulder and then performing a sweeping movement up and across to an overhead position before moving back down. If this is particularly uncomfortable, we can choose to put the hip down on the floor, or for more advanced practitioners, lift the hip and increase the pressure by reducing the effort of the hand that's keeping us supported on the floor. Again, as with all releases, we're looking for a slight sense of discomfort and not pain. If someone has a poor shoulder position or poor shoulder function, then this area is likely to be particularly inflamed and should be approached very gently and progressed cautiously. The last of our 6 key exercise areas is the chest or the pectorals. To perform this release, we're going to set up so that the foam roller is roughly at a 45-degree angle to the midline of the body. The arm is out at 45 degrees with the hand of the opposing side pushed down into the floor as if you were going to perform a push-up. From here, we lift the hips slightly and with the arm push at that 45-degree angle so that the foam roller moves directly along the length of the muscle. As with all of our releases, 4 to 6 rolls. Spans are slightly more awkward in that we have to turn the arm to create that rolling motion. Cross frictions, we can use our knees to lever ourselves forwards and backwards. And then mobilizations are performed as a sweeping movement or as a pressing movement to an overhead position. show you that from the side. Once you've set up in this position, initially, the opposite hand will push down into the floor and allow you to lift the hips. If you want to increase pressure, you can take the knees off the floor. Key thing to watch is that the lower back doesn't arch unless the hips are remaining on the floor, in which case you can use a very small shift forwards and back and roll the muscle in different sections. This is the other of the two main areas that are shortened and tightened by spending an increased amount of time in a protracted position, too much time at a keyboard, too much time behind the wheel of a car, and as such, it can be very inflamed and very painful to roll initially. So approach this area with caution and progress the amount of pressure that's applied gradually.